everybody, and welcome to Pink Ribbon Roller Coaster. We are so glad you're able to join us. My name's Jennifer Harrod. I'm the Breast Nurse Navigator with Project 31. And today we have a guest, Natasha Langhans. And Natasha is a licensed psychotherapist. She's been licensed since 2008. She's a marriage and family therapist and has also just finished her PhD in clinical sexology. And she is licensed in both Oklahoma and California. So I just want to welcome you, Natasha. Thank you.
Thank you for having me.
Yes, thank you. Thank you for being here. If you don't mind just telling us a little bit about yourself, really what your specialty is and what got you interested in your specialty.
Yeah. Um, so I'm originally from California and I had a private practice in California seeing individuals and couples. And then I moved to Oklahoma about 7 years ago. And I still see clients virtually from California. And I got my license instated in Oklahoma and started a private practice here too. Um, and after a couple years, I was wanting to go back to school, but I didn't really know what niche I wanted to kind of dive into. And I have a really good friend who's in my book club who is actually a surgeon. With Surgical Partners of Oklahoma, and she wanted to know if she could refer some breast cancer survivors to me, some of her patients that maybe needed, a little extra help that maybe a doctor didn't really have. Doctors are limited with their time. And so, could she send her patients over for counseling? And I was so honored by that question, and I really wanted to give it some thought. Like, could I give these women the care, the education, the therapeutic approach that they deserve? And that would be most helpful. And so I kind of started looking like what kind of education would be helpful for this group of people. And I found myself looking at um, like sex therapy and what that is. And so the specialty of sex therapy is so broad, but they do cover hormones, women's health, and cancer. And so I thought, okay, well, maybe I'll specialize in this. And as I was looking into it, there was a 1 year program or a 2.5 year program for a PhD. And so I thought, might as well dive in and get my PhD in clinical sexology. So it's kind of a beautiful thing that this question kind of led me to this specialty, but it's such a broad specialty. So not only do I work with women that are cancer survivors, but it could be people that are have had some sexual abuse in the past. Maybe it's a couple that have been married for a really long time that have desire discrepancy, libido issues. Maybe one partner would like sex more than the other partner. Sometimes it's painful intercourse. Sometimes it's some belief systems around sex. Maybe some religious belief systems that are getting in the way of having a relationship with sex that feels comfortable for them. So the specialty is pretty broad, even though it's very niche, and I'm really, really enjoying it.
Wonderful. Well, thank you for sharing that. That's a big honor for somebody to invite you in and ask you as well to learn more and be interested in speaking with some breast cancer survivors. I'm so glad you did that.
Yeah, I am too. It really is an honor.
And I know personally, and through talking to many ladies, that yes, after going through cancer, there is definitely everything our bodies go through or our mind goes through, it is a struggle for sure. What do you, as far as a psychotherapist,
Hmm.
what do you do? And really, how and why can therapy be helpful?
Yeah, I think that each case is different than the next, right? I really try to meet each client where they're at. And so, doing a deep history on each client, you know, who they are, where they want to be, what are their goals. And so, if their goals are to have a better relationship with their body image, then we stay there and we work around that. If it's not interested in sex at all, but maybe they want to be interested in sex, then we talk about that. If they don't want to have sex, and that's affecting their relationship, then we talk about the relationship. It really is different case by case. And I think that's the beauty of therapy is that it's so intimate, and it everyone goes at a different pace. It could be very slow, depending on how comfortable the client is. So really, I try to help each client figure out where they're at and where they want to be, and we kind of create a treatment plan together to get them to where they want to be.
Oh, wonderful. What would you say? Would you say a couple, if they're interested in therapy, should they start out as an individual or should they come in together as a couple?
Yeah, that's a great question. So obviously, couples counseling and individual counseling is very different. I love, as a therapist, working with both. I would really try to dive deeper to figure out, well, what is the goal? What is the biggest issue at the beginning? They're both very helpful. Um, Individual therapy really helps a client individuate, which is they gain more self esteem. They are feeling really good because they're meeting their goals. They're having one person, the therapist, support them in a really intimate way. Um, there's some individuation that happens that's very, very important. And for a survivor, that could feel very empowering and necessary. Um, if the main issue is relational, I would encourage couples counseling so that the individual doesn't individuate almost too much that separates them from their partner. So it's a very delicate dance, right? You want that pride and that self esteem and that individuation that's very important, but so often we also need to be reminded how to rely on another person, how to communicate with your partner, how to ask for help, how to receive. Um, and with couples counseling, maybe the couple needs to be reminded like how they fell in love or why they fell in love and
Yeah.
what brings these two very interesting individuals together, what makes them tick, what makes them great partners. And as a therapist, I love narrating that story for them. And maybe I can see these pieces that maybe they've forgotten along the way or they've lost track of. And I can see it in the room. I could see the way they love each other, the way they care for one another. And so couples counseling can be really beautiful in that way.
Wow, that's amazing. I know so many women that do struggle once they're diagnosed. And if they had problems in the marriage going into cancer,
Hmm.
I think really compounds the issues. And sometimes the marriages just really struggle. And like you said, I know many of the ladies kind of trying to find yourself
Hmm.
again and then find yourself as a couple. So that's beautiful. I love how you're able to help.
Right.
Um,
And crisis has this way of either bringing people together or pushing them apart. And
right.
cancer is a time of crisis, right? There's a lot of fear associated. There's the unknown. It's can be very expensive. There's so many different pressures that come along with the journey of cancer that could really affect the couple in a negative way. And like you said, if there was issues before, how do you navigate that? And so couples counseling can be really helpful for that. There's the accountability piece too, where, yeah, I try to be kind and caring and soft, but sometimes I need to be a little bit tough or call people on their stuff, right? And
Right.
so if a partner is not showing up in a way um, that they need to, after I connect with these people and I trust them, I have the ability to kind of call them out on that as well. So it's definitely a dance,
Right.
but I think that it's always helpful.
Right. Oh, I agree. I know I definitely went to counseling when I was diagnosed, and throughout my journey, and it's helped me numerous times in my life, just in traumas or various events that I've gone through.
Hmm.
So thank you so much. I mean, what about if somebody is wanting to go to therapy, but maybe they don't have insurance? What do you recommend? Are there any tips or tricks that you recommend?
Yeah, the way that I try to navigate that is if someone calls me and they want to use a certain insurance, I'm private pay, don't take insurance currently. I try to help them navigate their own insurance. So I will kind of give them some tips on maybe going on the insurance website, doing the drop down menu of therapists near me. I kind of try to help them navigate that. Sometimes insurance pay out of network. They don't pay out of network providers, but they reimburse the client. So clients can pay out of pocket and the insurance company will reimburse a percentage. Depending on the insurance, you have to call. Each insurance is very different in this way. So sometimes they'll pay 30%. Sometimes it's 50, sometimes it's 100, depending on the plan. But it's definitely worth inquiring about. Therefore, you don't necessarily have to see a therapist under your insurance plan. You could see an out of network provider and get reimbursed. There's also these SHA accounts. Sometimes companies give extra money into these different accounts that you can buy. Certain things that are medically in the FSA or the HSA account, you can use that for therapy as well. So there's kind of some workarounds. There's also sliding scale. You know, I think most therapists have some sort of sliding scale. I always allow 30% of my patient load to work within a sliding scale because I know that's important. And I've been there where there's just something outside of my budget, but it's something that's important to me. Besides that, there's always interns that charge a very low cost too. So there are options. There's always options.
That's great to know because I know ladies do and men. So many of the families, they're walking through this and they're struggling, and it's not just the patient. Many times, as we've discussed, it is the whole family. It's the couple. It may be children. So I think therapy is so important, and I'm so glad that we're having this conversation. Do you, if somebody lives maybe in rural Oklahoma, um, do you do virtual visits?
Yes, yes. I work 1 day a week in office at Premier Breast Institute in Oklahoma, where they do mammograms and they provide a lot of women's health. Um, but besides that, I do work virtually, and since I'm licensed in Oklahoma and California, my clients have to be living in one of those states.
Okay.
But if someone from a different state needed help, I could help navigate finding someone. I can help. And Psychology Today is a national website that really it works really well to find therapists. But yeah, this is my home office, and we're talking virtually, and I have a couch back there where my puppy was laying there a few minutes ago. But yeah, virtual is so helpful for people. And really, I think it's great. It's great. I do love working in person with clients, but virtual appointments are wonderful as well.
They are. And I've been to your office at Premier, and oh, it's beautiful and just very comfortable and inviting. So, definitely a beautiful space.
Thank you. Thank you. I really enjoy being there, and I love being around the other doctors and professionals. And it is a beautiful new building, and they've done so well.
It is. So, if somebody wanted to reach out to you and schedule an appointment, what's the best way to reach you?
Through my website, it's just Natasha, my first name, and then MFT, marriagefamilytherapist.com, MFT.com.
Okay, great.
Yeah.
I appreciate you taking the time to talk to us and
Um,
share your expertise. I
yeah,
love what you're doing. So,
of course.
thank you so much.
You're so
And
welcome. It was my pleasure.
thank you. And I want to thank everybody for tuning in today and joining us on Pink Ribbon Roller Coaster. Until next time.